Hello, everyone. You are stuck with me today for presenting, but we're going to be talking about heart health. So hopefully it is entertaining as enjoyable as possible here. Um, so just a quick kind of disclaimer here. This is not supposed to take the place of talking to your primary care provider. You might have some specific things going on with you that this may not apply to you specifically because of some other things going on. So you should always talk to your provider about what you should do, and any specific medical advice, you should consult them. So we're going to be talking about what is heart disease, risk factors, and lifestyle factors for heart disease. But first off, I mean, I guess the big question, maybe you can throw it in the chat here or just shout it out. Why do we care about heart disease? Like, what is it about heart disease? And for some of us, that might kind of invoke feelings with like loved ones who've struggled with it or passed away from it or things like that. So yeah, Jamila said, don't want a heart attack. Anything else? And there's heart attack is certainly one type of heart disease. So we'll kind of keep going here, but we'll look at what is heart disease in the first place. So we hear it, we know it has something to do with our heart. What is it? It is the leading cause of death in America. It is the leading cause for both men and women and across different racial and ethnic groups. It is obviously a big deal for that reason. Stroke is the fifth leading cause of death, which is closely tied to heart disease. In 2020, around 19 million deaths attributed globally to cardiovascular disease. 70% of major cardiovascular events in the United States are attributed to low and moderate levels of cardiovascular health. So basically, you have poor cardiovascular health, your heart's not doing too great, or you're kind of in between. You're not doing super great, but you're not terrible, is what that's looking at. High blood pressure and high cholesterol increase the risk of heart disease. Both high blood pressure and high cholesterol have no symptoms, so you may not even know that your numbers are high. And improving cardiovascular health can reduce or prevent cardiovascular events, like heart attacks or strokes. So that's kind of the gist behind it. We're going to look at the heart. So if you look at the heart muscle itself, it's made up of muscle. It is an organ. Organs are made of muscle, and it functions as a pump. So for all of the water folks that are in the water department, you have your water pump. Veins and arteries kind of act like the pipes that go from the pump to carry the blood to the rest of the body. It's about the size of a fist, so not super big, and it has 4 chambers. So you have the left and the right chambers on the top, and the left and right chambers on the bottom. So the top ones are the atria, the bottom ones are the ventricles. Veins bring the blood to the heart, and arteries, think arteries away, take the blood away from the heart. I will send out the slides and post those in the chat after the presentation, but no, each of these are a link. So if you want to see how this looks, anything underlined has a link to the American Heart Association, has little graphics for it. So you can see the heart's kind of pumping, and blood goes to the lungs. The blood from the lungs comes back to the heart and gets pumped throughout the rest of the body. So taking a step back, the reason we're looking at this, it's always helpful to know what is supposed to happen before you start thinking about what goes wrong. What is the natural way things are supposed to work? Heart disease is actually a blanket term to cover many conditions. And so when we think about heart disease, it's not necessarily one specific thing, but it covers many things, and many of them are related to atherosclerosis, or the buildup of plaque in the arteries. I have a slide to show you what this looks like in a second, because sometimes that graphics help. You can go to that link later if you want, but the plaque buildup causes the arteries to stiffen and narrow. So if you think about, if you sprain an ankle, what happens after you've sprained your ankle? What's your mobility look like? It's probably pretty stiff. You can't really move your foot. You can't really move your ankle. Same kind of thing what happens with atherosclerosis. If you get this buildup of plaque in the arteries and you get some damage to those arteries, that causes it to get stiff. It's harder for blood to go through the artery, and they get hard. It can lead to a blood clot because the blood is kind of pushing through in this closed, narrow artery, and that can completely block off the blood flow, which can cause a heart attack or stroke. Ischemia. If you've heard of ischemia is going to be used to describe something not getting as much blood, and therefore, if they're not getting blood, they're not getting oxygen to that part of the body. So when you look at a normal artery, it is nice and open. You get endothelial dysfunction, so basically you're getting some damage along the walls of the artery. Then you get a fatty streak formation, and then that gradually builds up. And now the blood's pushing against this blob and can go and cause a heart attack or stroke. Can be very, very scary, but there are things that we can do about this. So heart attack is going to be when that blood clot goes and causes a block to the part of the heart, one of the blood vessels in the heart. So you're cutting off blood flow to the heart muscle. If it's cut off completely, that part of the heart those cells are going to die off. Sometimes you can get like a smaller heart attack where it's not as much of a complete blockage, and so those cells don't necessarily die off completely. So there's different severities. I mean, you hear heart attacks are never good, but there are some that are better than others. Many people can survive their first heart attack and go to normal life. But there's going to be lifestyle changes. I used to work in a cardiac rehab. A lot of people, after they have a heart attack, there's a lot of medications. There's a lot of things to help with that, as well as lifestyle management. Signs and symptoms. Always good to know for you or anybody else. If you have chest discomfort in the center of the chest that lasts more than a few minutes and may go away and come back. Discomfort in one or both arms, in the back, neck, jaw, or stomach. Shortness of breath with or without chest discomfort. A cold sweat, nausea, and lightheadedness. Now this is important. Women can have different symptoms than men, which include shortness of breath, nausea, vomiting, back or jaw pain. Some of these are extremely vague. And I will say I've had a patient look at me and say, I have a hard time believing I had a heart attack because I thought it would have felt worse. Does not mean that you should not take it seriously. So you should absolutely still take it seriously. You want to protect yourself and your health and protect those you love if they are having signs and symptoms, and just really strongly encourage them. When you get to stroke is a similar thing to the heart attack. That blood clot from the atherosclerosis is going to dislodge and go into, instead of part of one of the blood vessels in the heart, one of the blood vessels in the brain. So ischemic stroke, ischemia, we talked about, that's a cutoff of blood or oxygen to a certain part of the body. So when it's an ischemic stroke, that blood vessel that feeds the brain with the blood becomes blocked and usually forms a blood clot. So it's going to be the most common type of stroke and is typically caused by that atherosclerosis. Again, if you want to see what this looks like, more so the blood vessel, it loads. This is the blood vessel we're talking about. So that right internal carotid artery is providing that blood flow to the brain. If that becomes blocked, that's going to be what's causing that blockage of flow. I'm probably going to butcher this. The hemorrhagic stroke is a weakened blood vessel in the brain ruptures, and that is typically caused by high blood pressure. So atherosclerosis, that buildup of the plaque, is going to be more likely to cause the ischemic, versus the hemorrhagic is going to be more so caused by high blood pressure. Reason being, if you think about high blood pressure, if you have a lot of pressure on really, really tiny blood vessels, typically does not go well. You don't want a lot of water pressure on really sensitive small pipes. Silent strokes are going to be a brain injury that's caused by a block of blood flow to the brain. So you may not even know you had a stroke. That is kind of the scary thing, kind of like that high cholesterol and high blood pressure. They're silent. They're known as the silent killers for a reason, because you may not even feel like you have symptoms. But the risk factors for that include AFib or high blood pressure, especially that high systolic blood pressure, that's that top number. So the difference between systolic versus the diastolic, that bottom number, systolic's going to be the amount of pressure on your arteries or your blood vessels when your heart is actively pumping, when it's contracting. Diastolic is between beats when the heart's resting. So hopefully you're not all going home and being like, I think I'm having a stroke. Please don't. Signs and symptoms of the stroke are that you have, you need to act fast. So we love our pneumatic memory devices here. Fast face, arm, speech, time. Face drooping, is one side of the face number drooping. Try to smile. If one side starts kind of falling over, that's an indicator of a stroke. Arm weakness. So if you were to hold your arm straight up, is one arm falling down? That's a sign. Is it number weak? Speech difficulty. Is the speech slurred? This is not just going to be like, oh, I am still drunk or something like that. Is it hard to understand? You are trying to say the grass is green. Can you repeat that correctly? And then time. Acting quickly is very important. If you have any of those symptoms, call 911 right away. So face, arm, speech, time. One thing to kind of help tell the difference, there is a difference between a cardiac arrest when people need CPR, when they kind of pass out, versus a heart attack. Cardiac arrest is an electrical problem. The heart gets electrical signals to tell it when to pump. They can happen when the heart stops beating expectedly and is triggered by an arrhythmia. So arrhythmia can be like that heart fluttering, heart's beating too fast or too slow. The heart's just not getting that blood to the brain or lungs or anywhere else in the body. They become unresponsive. They need CPR. They need an AED. Often it's caused by a heart attack, but other things can lead to it, like that altered rhythm in the heart. Heart attacks are a circulation problem. The actual heart muscle is not getting the blood flow. So if not reopened for that blood flow to get back to the heart, that part of the heart's going to start to die off. So you may have a heart attack and not become unresponsive. It's not like a guaranteed thing. You're going to have a heart attack and just be like passed out. Most heart attacks do not lead to a cardiac arrest, but they can. So risk factors. What can we do about it? What are kind of our risks for this? You can take steps to reduce your risk for heart disease. So one is high blood pressure. And this is why we are doing a lot of these blood pressure events, because it helps with making sure you're aware of what's going on with your health. High blood pressure or hypertension is the force of blood pushing against the walls of your blood vessels. Again, that systolic is that top number, amount of pressure when the heart is actively pumping. Diastolic is when the heart is relaxed. The higher the blood pressure, the more the heart has to work to pump that same amount of blood to the body. So if you have a lot of pressure, now the heart's trying to work really hard to get this extra blood that's coming to it to the rest of the body. Over half of Americans over 20 years old have high blood pressure, and many don't even know it. Because again, it usually doesn't have any signs. It's known as the silent killer for that reason. It tends to impact a lot more than just the heart or a brain. It impacts anywhere that has those really tiny blood vessels, like your kidneys and your eyes. Sorry, trying to think through these. Normal levels for for blood pressure is less than 120 or less than 80 is the bottom number. If your blood pressure is...
Hey, what's up, Fluffy?
Oh, somebody have a question?
Okay.
If your blood pressure is ever over 180 for the systolic or ever over 120 for the diastolic, that's where you need to go consult immediately. Go consult medical advice and go talk to a provider. Go to the ER if you need to. Even if you don't have symptoms, go talk to somebody, because this can make the heart become thicker and stiffer, causing the heart to work more abnormally. Again, it's a really high risk. It is known as a silent killer. You do not want to have this be what takes you out. So if it's elevated, stage 1 or stage 2, those are the levels. I have had people ask me, it used to be 140/90 being the recommended amount. Why is it 120/80 now? The reason is we found that if we started waiting to intervene in a later point, so if we wait until 140/90 to start, prescribing medications and start trying to intervene with that, it tends to not have as great of outcomes. If we start intervening sooner with lower blood pressures, people have better outcomes. They can get on medication sooner to help lower that. Some people, like there are some lifestyle factors that you can do to help with it. I will say my husband runs marathons and he is more active than me. And he still has to take blood pressure medication because he just has it run in his family. So to some extent, there is a family element of this too. I am a big believer in lifestyle, which is why I have the job I do. But there are going to be certain points where you need medication to help out. So cholesterol. Cholesterol is a waxy substance that the liver is going to produce and release into the bloodstream. We actually need cholesterol in our body. It forms the barriers of the cells in our body. It's part of vitamin D. It helps convert vitamin D in the skin. It helps us digest certain foods and helps develop hormones in the body. The problem is if we get too high levels of cholesterol or certain types of cholesterol. So there's the HDL, which is what we call the good cholesterol. It stands for high density lipoprotein. With atherosclerosis, if you think about it, you have these plaque buildups. HDL actually goes around our body and helps pick up some of that cholesterol from the bloodstream and the walls of the artery and take it back to the liver to get processed and actually, use it the way we should instead of just hanging out in our arteries. LDL cholesterol is what we usually call the bad cholesterol. It deposits cholesterol around the bodies. And so since it's depositing cholesterol around the body, it's also the one that tends to deposit it in the blood vessels. You may have heard of different types of cholesterol other than this, like fluffy LDL versus VLDL or things like that. Basically, the more dense, like the high density, the better. The very low density ones, like VLDL is very low density lipoprotein. Those tend to be the ones that are depositing the cholesterol around the body. The less density it has, the more it's depositing. So as it becomes more dense, it's going to be gathering more cholesterol. So hopefully that makes sense. And I did not just lose you all, but if you have questions, let me know. Triglyceride is a different type that's going to be a type of fat that's in your blood. And cholesterol and triglycerides form LDL. So that's part of LDL. There is a protein in there too. And then total cholesterol is going to be a combination of your LDL plus your HDL and 20% of your triglycerides. So it's not going to just be the LDL plus the HDL. It also has some triglycerides in there too. There's going to be other types of cholesterol that are not typically measured. That kind of includes the VLDL, but I have seen that more with providers. If that's what you're seeing, that's what the VLDL is that we just talked about. So hopefully you can kind of see the more cholesterol you have in the blood, the more you're going to have deposits in your arteries because there's just more to deposit. If the buildup starts to get too thick, that's where you're getting that atherosclerosis. And that's where you get the blood clots that become trapped in the arteries and block blood flow, leading to heart attack or stroke, which is why we worry about that. So normal levels for women typically need higher levels of HDL than men. Women should be 50 or higher, men 40 or higher. LDL should be less than 100 for everybody. If you have diabetes, a lot of times we recommend less than 70. And actually, the American Diabetes Association just recommended less than 70 for everybody who has diabetes for heart disease. Triglycerides less than 150 and total cholesterol less than 200. And then diabetes becomes a risk factor as well. So when you eat, your body breaks down food into glucose, which is a type of sugar. If you're looking at what diabetes is, typically in our body, we're supposed to have an insulin, a hormone produced by our pancreas. go to help get the sugar from the bloodstream into our cells. And this gives our cells energy because it is our body's preferred source of gasoline, essentially. It is what we function the best off of. With type 2 diabetes, though, the body doesn't make insulin well, or it's not using it well. So maybe we're producing insulin, but the insulin's not able to get the sugar from the blood into the cells, or maybe we're not even producing that insulin the way we should. So sugar's starting to build up in the bloodstream. As the sugar builds up, it becomes thicker, kind of like the consistency of honey. And the cells are not getting the energy. So regardless, if our cells are not getting the sugar that they need to be able to function and they're not getting the gasoline, they're not going to be able to function the best that they should either. A lot of times people feel tired. These high blood sugars, again, you have thicker blood. Now your heart's having to pump thicker blood. If you have high blood pressure on top of that, it's got a lot of pressure going on. And if you're trying to go through narrow pipes, you can kind of see how this is a recipe for disaster. The high blood sugars increase your risk for several diseases, including atherosclerosis, because that high blood sugar itself can cause that damage, that initial damage to the blood vessel that causes those fatty streaks to start forming. And it can also cause peripheral artery disease. So peripheral, arms, legs, it's going to be artery damage in our blood vessels in our arms or our legs. It can also damage nerves and cause nerve damage with that. And people with diabetes often have high blood pressure and high cholesterol and difficulty managing their weight. If you've ever heard about the ABCs for diabetes, it's A1C, blood pressure, cholesterol. And the reason for that, these are the three conditions that are big risk factors for heart disease. Normal levels for fasting blood sugar. So fasting blood sugar gives us a snapshot in time of where your blood sugar is at that moment when you haven't had anything to eat. This is basically telling us how well is your body doing at managing your blood sugars without food involved at all. How well is your pancreas or is that insulin working and getting that blood sugar into the cells? It should be less than 100. If it's more than 100, that can be pre-diabetes range up until 125. Diabetes is 126 or higher. A1C is looking at over the last 3 months, where has your blood sugar been on average? Hemoglobin is a protein in your blood that sugar can stick to, and it lasts about 3 months in our body. So it's going to give us about 3 months of how sticky is that hemoglobin. Normal, again, is 4 to 5.6, somewhere in that range. 5.7 to 6.4 is in the pre-diabetes range, and then diabetes is from 6.5 or higher. And usually by the time that somebody's diagnosed with diabetes, we know at least about 50% of the cells that produce that insulin have died off. And it's not to say that you can't go into remission with diabetes, but your body is struggling to help manage those blood sugars just because the pancreas isn't producing the insulin like it should. Metabolic syndrome is itself a risk factor for heart disease. So metabolic syndrome is basically a cluster or a grouping of risk factors for heart disease. They can lead to heart disease, diabetes, stroke, and other different types of health problems as well, which it includes high blood sugar, low levels of HDL, that good cholesterol, high levels of triglycerides, a waist circumference above normal, and then a high blood pressure. Hopefully some of these look familiar because these are a lot of the things that we measure on our biometric screens. We take total cholesterol, triglycerides, HDL, waist circumference, blood sugar, blood pressure. While each of these is its own risk factor for cardiovascular disease, 3 or more of these increases the risk of a severe serious cardiovascular condition. So it's a good time to be kind of checking in with your provider and making sure you're following up and doing what you need to do to help reduce your risk. So the American Heart Association puts out Life's Essential 8. And so this is going to be my plug. We're going to start our heart health program that's going to be on Teams next week on Wednesdays at noon. And it's Life's Essential 8, going through some of these risk factors, what you can do to reduce your risk. Smoking, tobacco use itself being a big risk factor because tobacco itself is a risk factor for diabetes and blood pressure. And that does not just include cigarettes. Eating better, getting active, getting healthy sleep, losing weight, managing blood pressure, managing cholesterol, and reducing your blood sugar. So really looking at some of those conditions, but also some of those different lifestyle habits, in addition to some other ones that can kind of impact our risk factors for blood pressure, cholesterol, diabetes, and therefore heart disease. One of the big things that I kind of look at and leave you with here too, though, is this DASH eating style is what's recommended by the American Heart Association, and it's recommended to help reduce blood pressure as well. It stands for Dietary Approaches to Stop High Blood Pressure or Hypertension. Focuses on fruits, vegetables, and whole grains because fiber we know helps with reducing our blood pressure. It helps with reducing cholesterol. It helps with weight. There are a lot of different health benefits to fiber itself, and that's without even really necessarily changing anything else. Even reducing weight, you can still get benefits from having lots of fiber. Incorporating low-fat and fat-free dairy products like fish, poultry, beans, nuts, vegetable oils. My rule of thumb when it comes to helping reduce your cholesterol in foods and saturated fats, we look at saturated fats a lot and trans fats. The more legs an animal has, the more fat it's going to have. So if you have a cow or a pig with 4 legs, that is going to have more fat than a chicken or turkey with 2, and more fat than a fish with no legs. Your plant-based ones are going to always be leaner and better options. The parts of the animal that move the most, the animals that move the most are going to be leaner than the ones that don't move around a lot. So if you think about like farm raised, you hear about farm raised being leaner. Well, the farm raised and the free range tend to get to walk around more. If you think about the people who, for you, like even in your life, you're usually leaner and you usually have more muscle mass if you move around more. So same thing goes for the animals we eat, if we're eating animals. And deer tend to be leaner as well. And then limiting that saturated fat, sugar sweetened beverages being a big one. And then sodium. Sodium is not just in salt, it's in a lot of prepackaged foods. And then also sweets. Sodium is a wonderful preservative, which is why people tend to use it a lot, but not necessarily great for our health. Oops, sorry. So when you look at, kind of going back to the beginning, if you look at cardiovascular events, 70% of major cardiovascular events in the United States are attributed to that lower moderate cardiovascular health. But even a partial improvement in your cardiovascular health scores to help reduce your risk leads to a reduction of 1.2 major cardiovascular events each year. Every year, you look at that, that's a lot of cardiovascular events that could just be prevented just by reducing your risk factors. 2 million major events could be potentially prevented if all the US adults could attain high cardiovascular health. So there's a lot we could do. These are the different lifestyle factors: smoking, BMI, physical activity, following a DASH diet, cholesterol, blood pressure, and blood sugar. And this is the difference in the cardiovascular health. So poor cardiovascular is somebody who's currently using tobacco, a BMI over 30, not physically active, not meeting goals within the DASH diet, has a cholesterol over 240, blood pressure out of range, and blood sugar out of range. Versus high cardiovascular health is somebody who's stopped using tobacco or is no longer is a non-smoker. Somebody who has a BMI less than 25, getting 150 minutes of activity per week, meeting 4 to 5 of the goals in the DASH diet, less than 200 for cholesterol, and then a systolic blood pressure in range and blood sugars in range. So not in the prediabetes, versus moderate is kind of in between. There are risk calculators to help you as far as figuring out what your risk score is. So I'm going to pull up American College of Cardiology. Like there's a little bit better. Just because it's a little bit more user friendly. I will say you have to be at least 20 years old to use this. So I'm going to make up some data here. So I'm female, I'm white, In order to get an actual range, sorry, you have to be at least 40. So I'm going to pretend I'm 45. I'm not. But I'm going to pretend my blood pressure is 131 over 88. My cholesterol is 205. HDL is 38, and my LDL is 70. I do have diabetes. I'm a current smoker. I'm on treatment for high blood pressure. I'm on a statin and I'm on aspirin. And so this is just asking if you're trying to pull data from a previous time you've entered it. So this is saying my lifetime risk of getting a cardiovascular event is 50% with this data. Over the next 10 years, I have a 13.5% risk of having a heart condition. To put this in kind of frame of reference, you want that to be as low as possible. Optimal risk 0.5. Ideally, that would be where you are. 4 or 5% or less is usually considered pretty good. So 13.5 is kind of high. And then you can determine therapy. So if I were to quit smoking, intensify my statins, you can see the risk goes down. So it's 9.8% reduced from that 13.5 down to 9.8 if I stop smoking. If I start a statin, it goes down to 7.4. Manage my blood pressure, goes down to 5.4. And continue aspirin, down to 4.9. So you can kind of play around with that if you want and kind of see what therapies or things can kind of help with reducing your risk for cardiovascular scores. Things don't change overnight. We all know this. That's not going to change overnight, but it is kind of good to help see some of that picture. So again, what is heart disease? Looking at it as the leading cause of death, how the heart's supposed to work, and then what kind of goes wrong, risk factors, and then lifestyle factors. A lot of this with the blood pressure program, we're going to be diving into more. So we'll look at some other heart conditions that can kind of come up, dive into some of those infographics, hopefully help answer a lot of questions you guys might have. And then really dive into how you can reduce your risk and what other risk factors come up, like alcohol or stress and things like that, and how you can manage that. So that's coming up. Feel free to register, just email me. As you're thinking through though, something I want to kind of leave you with is what's something that you can do today to help reduce your risk, or what are you going to do with this information? So maybe it's taking steps to manage your nutrition to reduce your heart disease risk, increasing your physical activity level, stop using tobacco, talk to your provider about how you can better manage your risk, or just sign up for the heart health program, something. At the doc, we're always happy to see you all if you're on the city's insurance or if you have an occupational health injury. We always love seeing your guys' faces. We're happy to talk to you about reducing your risk as well. If you need any resources, we do have Community Care Connect. It is technically a site called Aunt Bertha. We were talking about this earlier, but you can scan that QR code. Lots of community resources available to you. Sources. So, and any questions?
You can unmute yourself to ask the questions, or you can ask in the chat box.
Great overall presentation. Thank you.
Yes. So I have a question, Sarah. I know we're not talking about calories or anything like that, but when we talk about like plant-based meats compared to like beef, obviously, but like I thought about trying the plant-based Whopper, but whenever I looked at the overall like nutrition factors of it, calories and all of that, the plant-based was more than the beef burger.
Yeah, so that can be kind of tricky a lot of times because sometimes they do this with cauliflower crust too. They'll add more fat to it to help it taste better, or sometimes they'll add more salt to make it taste better. And the way they season it sometimes makes it not as great for you. There's always going to be kind of weighing the pros and cons of things. So sometimes the calories do go up. The fiber is usually really healthy for you. But a lot of plant-based things have a lot of carbohydrates. So like black beans. Black beans are great in protein, but they do have carbohydrates. So if that's going to impact your blood sugars, that's something else you need to kind of think about too. That being said, it's kind of like a combination of kind of looking at your own specific factors and what's going to be most important to you. Maybe it is cutting calories. So maybe it's like, all right, I'd rather have a leaner burger that has the real meat because it's going to have less calories for me, even though it has more saturated fat. So like turkey burger tends to be leaner than and less fat than like a beef burger.
Right.
But, yeah.
Huh. So from a overall health standpoint, heart especially because you only get one, right?
Yeah.
It's good to just look at the overall nutrition of a food.
Yeah.
You know,
Yeah.
because you can be, eating for your heart and gain 5,000 pounds.
Yep.
Not really, but you know what I'm saying? Okay.
Yeah.
Just thought I'd ask.
No, I mean, that's always a good question because food's always kind of tricky because there's going to be things that are better for one person, but it's not necessarily going to be better for the next person. Like generally you do want a lot of fiber, and some people do respond really well to having more fiber. Other people, they keep having lots and lots of fiber, but it doesn't quite, for some reason, manage their blood sugars the way you would think it would, or manage their calories and their weight the way that you would think it would. So generally it does help, but we're all different in our own way, which is good, but makes it more exciting.
Any other questions?
Sarah, what about oil? I saw vegetable oil on there, and I've heard before that, stay away from vegetable oil, canola oil, all of that. Just use like olive oil. And you speak to that?
Yeah, so there's different types of, so we talked about saturated and trans fat, and we'll kind of get into this more in the program too, but there's monounsaturated fat and polyunsaturated fats. Generally, your polyunsaturated fats are going to be a bit better for you, like your walnuts, your fish oil, and that's where olive oil tends to be a little bit better. Canola oil and safflower oil tends to have more of omega-6s. When you look at it, omega-6s tend to be a little bit more pro-inflammatory versus the omega-3s tend to be more anti-inflammatory. That's where that's coming from. You need both. I mean, there are certain times, like if you just couldn't ever clot your blood, that would be bad. If you got cut, you would bleed out. You do need both. That being said, like olive oil tends to be better, but your canola oil and your safflower oil are still going to be better than butter or margarine or Crisco and those kinds of things. So it's more of a spectrum versus like choose this, not that. Those things are helpful, but yeah, not always the most helpful.
I had a question. We used to have a blood pressure machine in City Hall that where you could sit down and stick your arm in a cuff. And is there any chance we can look at something like that coming back?
I will add that to my list.
Thank you.
Sarah, I had a question. I try to eat a healthy fat with each meal. Is there a big difference between the green versus the black olives?
Ooh, that is a good question. I think the green olives tend to just have more sodium and be more salty, but I don't know on fat content. I'll have to get back to you on that one.
Okay.
I don't know that there would be a huge difference.
Okay, because I know they always talk about the different olives that are, good for you. And I just didn't know. I know the salt was one, but I didn't know if there was really a big one. So thank you.
Yep, I will look into that and get back to you.
Sarah, we have a question in the chat.
Oh.
Oh, sorry, this comment.
Oh, yep, veggie patties and see nutrition value. Oh yeah, there's some veggie patties that are really good. Like I think you just kind of have to check them sometimes. Cauliflower crust pizza can be really good, but just kind of watching calories and fat content. Why restaurants always add fat and salt to things.
Any other questions? While we're waiting on the person that might have some questions, the person with the telephone number, could you actually put something in the chat box of your name so I can make sure that you get credit for being in the course today? Any other questions? Okay. Sarah, any final words? Oh, would you
Yeah, I was gonna.
tell about the program again for the people that weren't on here at the beginning of your session?
Yep, so we have the heart health program. I'm gonna go back. It is gonna be on Wednesdays over Teams, from June 26th to July 20th. It is 4 weeks. And just to kind of, if it's any field people want to hop on, you can call in. But that'll be going on June 26th to July 20th. So, and then I think August, we are going to have digestive health specialists do a talk on colorectal cancer. So that's going to be coming up August 16th. Is that the right date, Jamila? Think.
I do not have my calendar in front of me.
Let me
It's on my
look in a
door. I
second.
usually have it open so I can kind of peek over there. I believe it's
Pretty sure
August
it's August
16th.
16th. So yeah, that's going to be coming up for the next Lunch and Learn. So we're skipping July.
I was gonna say there's no July.
And then
Sarah
we're
and I
doing
both
stress
will be on
management in
vacation at
September.
different times.
Yeah.
Okay, does anyone else have any other questions before we end our session? Well, thank you again, Sarah, for your time. Oh, wait a minute, hold on. One popped up.
Are there
Sorry.
studies where people have had heart attacks who have no cholesterol or high blood pressure issues? I am not sure on that. I know there is some genetic side to it. We do have a family friend that has had like 10 heart attacks and started at 40, which is usually younger than most people have heart attacks. So I think there's some genetic kind of predisposition to it, but usually I think that kind of starts with cholesterol issues. Because I do know for him in particular, he has atherosclerosis. So that's what leads to it. Have to have some sort of blockage to cause it. So. Yeah, thanks
Hey,
everyone for hopping on.